penetrate the flesh.
Wow, I see you brought some friends.
Oh my God, are those
Maggots.
Yeah, those are maggots. What's up, YouTube? Welcome back to the channel. Tonight we're diving into the Pitt, episode 2, season 2, round 2, deuces.
Deuces.
Thanks so much for coming back with us. Our last video was episode 1. So many comments, so much engagement. You guys were awesome. So many really thoughtful questions that I've been thinking about a way to answer, like, thoughtfully, honestly, truthfully, but thoroughly. And so I've got some ideas for how we might do that. So stay tuned to the end because we might drop a little teaser on that because this is really exciting.
Yeah.
And we had so many new subscribers from that video. Thank you so much to all the people who decided to join. Those of you who might have found us for the first time. And to all of the OGs, those who have been with us since the beginning, thank you for coming back and watching with us again. We can't wait to dive into episode 2. I can only imagine what Robbie and company, by the way, Golden Globe winner, Robbie, or Noah Wiley.
Yes.
So congrats to them on that. I mean, well-deserved, obvious winners. I mean, this has been really amazing show. By the way, I'm Dr. Todd, board-certified internal medicine doctor working in primary care with my wonderful wife, Allycia.
What's up?
I don't know. That's about all I got before we jump into episode 2.
Yeah, season 2. The Deuces.
All right.
Is that what it's called? Deuces?
I don't think this episode's called Deuces.
Okay.
I think this episode's called 8 a.m.
Oh. Does the shift start at 7 then?
Yeah.
I don't know.
Did you learn nothing from the last episode or from the last season?
I learned things.
Well, the structure.
I learned tachycardic.
Yeah. Well,
I don't even remember what that means now.
Never
mind. I learned nothing.
You'll figure it out.
I'm better with images.
Yeah. So the season is literally just picking off from season 1, where
Shoot. You know what I was gonna do? I was gonna put pictures with everybody's names.
I don't know what you mean.
And have a cheat sheet because I'm really bad with names. But that's how I learned my cheerleaders' names.
All right. Well,
go ahead.
We'll draft that. We'll draft that. She's a cheer coach. That's what that reference meant. We will draft that up for next episode. But for now, I do have my handy dandy notebook so we can take some notes. Mm-hmm. Let's get it.
I was wondering if they were going to start where they left.
Trauma's at the back door. This.
Did she lose a baby?
I don't know.
Let me know when the rest of her labs are back.
Well, she's very disturbed by it, though.
Okay, come find me when he gets here. You talked to the trauma counselor this week?
I'm going to. Promise.
Okay, good.
The trauma counselor? Oh, okay. They have counselors coming in for their mass casualty event.
Probably. Unless there's something else that
I
happened
don't want to think about what my gut is saying right now.
Yeah.
without us knowing yet.
Come find me when you know more.
Us, if you don't mind.
I don't mind us. Come find us when you know more. Do you want to jump on this trauma?
Spread
Want
across
this one
the
getting
room.
away from me.
We don't know what this is yet. Don't go jumping to conclusions.
I'm not jumping to anything.
So
I'm
we're
just looking out
probably
for my
gonna
patients.
like this doctor by the end of the season.
You think?
But, we are, but they're laying it on thick.
Staxis, non-focal neural, betonized head trauma. But every time I check on him, his affect has drastically changed. My gut is telling me something's not right.
His affect. I know I feel like I've heard doctors say that before.
Affect is essentially the
I couldn't decide if I was thinking Aflac or if I've actually heard affect.
really.
I don't know.
So, like,
I feel like I've heard it.
affect is like the
The way someone looks.
well, it's sort of what they're projecting. And so, like you
okay.
could have a happy affect, a flat affect, if somebody is just like monotone, and you can have a restricted affect if you don't go, like, if you can't get high or low. And so,
Okay, that's not really a medical term then. It's
it is. It's
it
very-
is.
well,
You
it's in
guys
the-
use it in the medical community.
especially in the behavioral health world.
Oh, interesting. Okay.
Alan Billings, pallet of roofing tiles fell 8 feet, his upper arm with an open dislocation. Ouch. 2 rounds of fent, 1 then 0.5 per.
Yeah, that's like the bone that's coming through his armpit, right?
Yep.
Oh, straight. Mr. Billings, I'm Dr. McKay. And I'm Dr. Garcia from surgery. And this
You've
is
seen a
Dr.
bone through an
King.
armpit before?
I don't know that I've ever seen a bone through an armpit. I mean, I've seen bone through like shin.
Oh yeah, no.
Sounds like a Harry Potter spell. Laxatio erecta. Correct. Check the neurosurgeon.
That's interesting. Look, I can't even say. I'm not even gonna try.
Yeah, I wouldn't have known either.
Lazatio.
Don't worry, Mel. I wouldn't have known.
Okay, sedation orders, Dr. McKay.
100 of propofol titrate to effect. Be back with that.
They're liking that word this time. Effect. What? Isn't that what she said?
No, different.
Different? That's why I don't like it.
Medical students Ogilvy and Kwan are going to be working with me.
Hello.
Student doctors.
You want them to try it?
So actually, there was a medical student in the comments that pointed out that he had caput medusae, which is dilated veins in the abdomen, which kind of sprawl out across the abdomen, and that's a bad sign of portal hypertension.
Is that why my stomach looked like that at the end of our?
No, that's different.
I was pregnant. Yeah. My veins spread across like that?
Yes, but that's a different problem.
Okay.
Yeah, always make sure your entry point is safe by identifying the pocket of fluid.
That's not a pocket, that's a lake.
Yeah, but you do not want to hit a vein or artery on the way in, so make sure you check with color Doppler.
So this is going to sound a little insensitive, but I had a resident I worked with that when their ascites was that big, he would say, Ray Charles could tap that. Because it was so easy.
So you glued your eyes shut with what exactly?
Super glue?
Okay,
Was she trying to put on fake lashes?
Can I just talk to Dr. J? She'll know what to do.
is that an ophthalmologist?
Is that the new doctor?
I know what I'm doing most of the time.
Most of the time.
For a Z-track, we pull up the skin before advancing into the peritoneal space.
What tests do we want on these fluids?
Cell count to rule out spontaneous bacterial peritonitis.
Ding.
Diagnosis, Joy.
Absolute neutrophil count over 250.
Ding. Yeah, so we learned also that they are students, not residents.
Okay. Yeah.
Hey, Dana, can you get Kiara down here for me? She isn't answering her spectral link. She's not working today. It's,
SpectraLink. Remember those?
I don't know what that is. SpectraLink.
That's that hospital phone.
Oh,
Secured phone.
yes.
Yeah.
Seriously, thinking of a double residency, let me save you the trouble. You can't do it.
Why? Just because you couldn't do it?
Honestly, yes.
Oh, okay.
Oh, shit. I have a nun with conjunctivitis. Her swab is showing gram-negative intracellular diplococci.
What the heck is that?
Gonorrhea? Come to Jesus.
Didn't someone in our comments say something about that?
Yeah.
Stay. Maybe it's an immaculate infection. Pull the left so clear this up. Tread carefully, Missy. There's a nun with gonorrhea in her eye.
Okay, write that down. Like, how could a nun get gonorrhea in her eye? Or we don't want to talk about that. I don't know. Did she touch something and touch her eye? I don't know how it's transmitted. Well, okay. I know that it's STD. I'm just saying. Can you touch a surface and get it in your eye?
Probably not.
Dr. Mohan can cut your cast off now.
How long's the cast been on?
I don't know, but it's really getting itchy.
Okay, this cuts the cast.
By the way, I also found out in the comments that this is that new nurse's very first acting role.
Oh, hers?
Yeah.
Okay.
So that's pretty cool.
Yeah, that's cool.
Welcome to the show.
Yeah. I was always terrified to have a cast on for the removal.
Thank
Yeah.
you.
Yeah, like, cause if you ever heard of anybody getting cut open from the cast removal?
No, and I think, if I'm not mistaken, the saw is, I think, designed not to really penetrate the flesh.
Wow, I see you brought some friends.
Oh my God, are those? Maggots.
Yeah, those are maggots.
Oh, man.
Poor guy.
I know. That's what
In school, am I right?
God. It's eating him. Or was that eating his what? No, that mate. Okay, never mind.
Okay, on my count.
They're just bringing out all the gross factor in this episode.
Motherfucker.
Now, what are they doing?
My head is
They're
not
trying to
reducing.
reduce it. They're trying to.
Should be done in the OR. I am the OR.
Yeah.
Okay,
So reducing means basically taking the dislocation and relocating it.
Okay, why? No, like this
Lift it
is
above the glenoid. That will convert this to an anterior dislocation and should pop right back in.
dig inside of him.
2, 3. Very cool.
Not cool.
Shoulder immobilizer and CT. Guess you guys don't need me anymore.
Oh, come on, Mel.
What happened?
She's been different.
Well, my deposition
since
is
the
today.
Oh, that's
lawsuit.
right.
Do you want to talk about it?
I'm not allowed to.
No, we don't have to talk about the deposition, but we can talk
feeling.
about how it is affecting you. 9 times out of 10, the doctor wins. I've been sued 4 times myself, Dr. Al.
9 times out of 10.
I've never been named in a lawsuit.
It's not helping.
But sometime.
Oh,
Sister Grace,
Oh, how are they gonna tell her?
under the microscope, we're seeing something called a gram-negative bacteria.
How did I get it?
I'm kind of hoping you tell us.
It's gonorrhea. Traditionally, that's the sexually
I know what gonorrhea is, Dr. Javati. I'm a nun, not a numbskull. Part of my day is spent doing laundry, making beds, disposing of old clothes
Do you wear gloves?
when they're available.
I bet we can scrounge up a couple boxes of gloves while you're here. It's important to protect yourself. We'll be back.
Yeah, see? You get it a different way.
I'm so sorry to say that he died.
So this conversation never gets easier.
Yeah.
Dylan? Bradley. Is this the tumble down the stairs kid, Kylie?
Yeah.
And
I'd like to talk to the girlfriend first, away from the little girl.
Who's this guy?
Oh, this may be the new social worker.
Okay. There's a new one?
Well, it said covering for Kiara.
Baby Jane Doe. Everything looks normal so far, but you seemed really concerned earlier. She still needs a catheter in.
or not.
They're really clashing.
Yeah. Well, we're sending you for a CT, not an MRI, so it's like a open donut.
Oh, good. I like donuts.
Much friendlier.
Yeah, I know.
Oh, no, it's just with other
Deposition.
patients.
Oh, this is the guy.
So, what do you do for fun?
I mainly do what my sister likes.
She probably has no life outside of that.
The Renaissance Fair.
Really?
Yeah.
Isn't that kind of dorky, though, where everybody dresses up like somebody they're not?
Oh.
Can be anyone or anything you want. I actually had this alter ego that was a 17th century French woman's alter ego.
Oh, no.
You okay, kid? It was a doozy.
That was a doozy. Oh, man. I was kind of hoping that was like a
Yeah.
love interest there.
Nope. Plus, you really shouldn't date patients.
Duh. I was your patient once.
We're going to have to clarify that later. No, you weren't.
They look for nitrates and we calf.
Dr. Al, should we get it?
Get it.
There we go. Looks like you got a good midstream sample.
Here's a fresh blanket.
Okay. Plan.
She's not impressed
No.
at all.
Well, she's really trying to establish herself.
Yeah.
So she's being a bit adversarial.
Linda Stevens, 1 episode of substernal chest pressure resolved with rest. 12 lead negative for STEMI, heading for North 4.
Stimmy.
Cath lab. ST elevation MI, heart attack.
Okay. I'd heard it before. I don't know if it was in the show.
I have an app on my phone that can listen to our conversation and the details of my physical exam and write it all up in your medical record.
Wow. This is why they're talking about AI in medicine.
Yeah.
You need to get checked out.
I'm fine.
No choice, it's work related. Let's find her a room and prep her burr hole.
What? I forgot how much you like to joke. Captain Scurvy.
Captain Scurvy.
Good.
The billing syrup for surgery.
Lay that order, sailor. Dr. Ravinovich.
Nurse Hastings. You'd call me Ravi.
You can call me Noel.
Oh, why was that weird?
Tell me what the hell's going on here.
Okay.
This is Noel.
Oh, he needs surgery.
Which his insurance will pay for at Westbridge Memorial, not here.
Good grief.
The transfer?
If he's stable.
I believe that he is.
Oh, that's fun. Did you ever have that?
No, not precisely this.
Okay.
Or at Westbridge, don't you agree? Robbie?
I'm sure that he will.
What am I missing?
Yeah, what are you missing?
Anything else happening with Alan Billings that I don't know about?
Not medically.
This is just a simple insurance transfer. Yeah, okay.
Yeah, okay.
Didn't feel like nothing.
Dr. McKay has a very heightened sense of empathy,
Meaning?
No.
meaning she's good at picking up on stuff.
Oh.
You didn't say anything, did you?
Okay.
I subscribe to the Falstaff advice. Discretion is the better part of valor.
Oh, are they about to drop that? They're having a fight with that insurance company or something?
Don't understand why you can't leave in the morning.
I thought that meant that they're in some sort of relationship.
I'll find you before I leave.
Okay.
Right? Am I
I
misreading?
don't
it?
know.
Hastings. Evans. Hope you know what you're doing.
What is that?
Oh, they
supposed
have to be then. Look at that look. She's got her glasses. Yeah, they're in a
That's good.
relationship.
Follow my finger. How's the head?
It's a little sore.
I love their relationship, by the way. Langdon and
Yeah, Mel.
Mel. Yeah, thanks.
I can get you some Tylenol unless you need something stronger.
Oh no, that's okay. I'm not very drug tolerant.
Lucky you.
It was okay. All right. I want to see the conversation with Santos though.
You know why I was
See my
gone?
patient? No, not really. I mean, I've heard rumors, but I learned a long time ago not to listen.
I was in rehab.
Oh,
Okay, he's just gonna tell. Okay.
Yeah, I didn't handle things the way I should have. I thought I could treat myself and I let a lot of people down. I'm sorry, Mel.
you never let me down.
Oh.
If we do find him, you may have to testify in court, Dr. King.
Oh God.
In court.
Just more what she wants.
Simple stuff.
Yeah, but we'll cross that bridge when we come to it, right? No? Rest here a minute. I'll be right back.
She's just like had way too much.
I'm fine, really. I should just.
10 minutes, please. Doctor's orders.
ER can be a little bright and noisy.
He learned that from her.
I know.
That's really cool that they brought that back around.
Let us know if the chest pain returns.
Thank you.
You are so welcome. What do you think?
Well, I don't think it's cardiac.
I mean, what do you think of the app?
Oh.
Okay, so then maybe.
That's all she cares about.
So then it's not a STEMI.
Oh my God. Do you know how much time this will save? Studies show you can spend 80% less time charting.
80% less chart time.
Yeah.
Takes Risperdal and antipsychotic. She takes Restoril when needed for sleep. So is that
AI. Almost intelligent.
I like that.
I like that.
You must always carefully proofread and correct the minor errors. It's excellent, but not perfect.
This is amazing.
What check it up?
I could see how that could.
I'm sure Farsi Valadi. You speak Farsi?
I
Farsi.
LA, a lot of my friends are Persian.
So you learned the language?
Enough to break the ice.
I am impressed.
Oh, he's got some riz.
You had that moment once. Not Riz. Just speaking another language when they didn't know.
Yeah.
Mrs. Bostic?
Takotsuba, broken heart syndrome?
no.
Not yet. Takotsubo.
Takotsubo.
That is a very interesting medical phenomenon. We will talk about that at the end. Otherwise known as broken heart syndrome.
Yeah.
Oh, can he please come see me?
So she's got memory issues.
Yeah, clearly she's got dementia.
Okay. Are we gonna tell him again?
Die?
Tell her again.
No. No, that's impossible.
This is horrible.
We need to take some blood now.
He had to do that.
Yeah, but I promise it'll go super fast and only hurt for like a moment, okay? So.
So this could get interesting. We'll see what happens.
With the blood work?
Well, or like when they remove the rubber band.
Interesting. What?
See if she like bruises excessively.
Oh yeah, from what you were talking about.
Tough little girl.
Yeah, well, little girls can be just as tough as little boys, even tougher.
Yes, I just hope it's not because she's become accustomed to pain.
Yeah.
Oh. But would that have... She had blood in her urine, though.
Yeah.
So that doesn't really explain that.
Well, I mean, it could just be very easily injured.
Yeah.
With an infection, it'd be kind of cloudy.
Gosh, that's a lot of fluid.
However, he failed to mention that bloody fluid indicates either a traumatic tap or the likelihood of hepatocellular carcinoma, in which case we would send for cytology.
That is correct.
Yeah, you gotta be careful here, man.
I know. He's very confident with what he knows. You know they're gonna make a fool of him at some point.
Well, we all need to be.
Yeah, I mean, humble him.
humble
That's
at
what I
some
meant.
point, yeah.
Not make a fool of, but
Ogilvy is really smart and likes to show people.
he's obnoxious.
Well,
What he is your competition. He's a gunner.
Gunner. What's that from?
Gunner.
Yeah.
Well, that's the term of like a super.
You've talked about it before.
Yeah.
Okay.
Yeah. Like gunners are those extremely ambitious med students or residents.
Yeah.
Oh, I'm still a student, Doctor. Whitaker's the real deal now.
Right.
Oh, welcome back.
Thanks. Yeah, thank you. It's good to be back.
Oh, why is he's covering his badge? You see that?
Who is?
Langdon. He's
Oh.
embarrassed about what it says.
What would it say?
I didn't see it.
It's still doctor.
Maybe because it doesn't say like senior resident or something. I don't know.
I doubt it.
Bacon grease from a big griddle.
Looks like more than a splatter.
Yeah, some fool put it in a sink while I was washing dishes.
I was so far.
It just says doctor.
We're gonna need to trim off some of the dead skin so it doesn't get infected.
I'm in charge of the brunch buffet. Can you make it fast?
Yeah, right back in no time.
Why didn't you call 911? He wouldn't let me. He was talking, not so much now.
Orlando, Mr. Diaz.
Jesus. He drunk?
No, ketones on his breath. He diabetic?
I don't know.
Oh, you can smell that?
Yeah, it has like a fruity smell.
Okay.
Medicare requires a 3-day hospitalization before they'll approve that.
I don't really have a reason to admit her.
But I do. She's greatly disabled. I'll put her on a cycle. We'll make it work.
Yeah.
Thank you, Caleb.
Dylan just talked to the girlfriend.
You'll have to fill me in a minute. What do you got?
AMS. Can't tell if he fell because he was altered or he's altered because he fell. There's ketones on his
Okay, I
breath.
got this. Thank you.
That's really hard.
And Langdon made that assessment in like 3 seconds. Like that's really, really impressive.
Yeah.
If he doesn't, looks pretty guilty.
Let's not jump to any conclusions just yet.
I'm not jumping. I'm just saying if this dude doesn't show up, hell, I'll go find him myself.
Kylie before her dad gets here.
If he shows up.
Yes.
Yes. He's like, we need to talk.
Abdomen is soft, non-tender.
How do you know it's non-tender?
Because I didn't say grimacing.
He's altered. He didn't even flinch for the IV start.
I meant to say non-rigid.
It's going to be interesting.
No evidence of upper motor neuron deficit. Good.
EFAS negative. How can I assist?
So,
Do you have any
checking.
gunners in your class?
I mean, sure. I don't know that I ever had any. I never had any beef with anybody.
Oh, were you saying you were a gunner?
No.
Just kidding. You were. I interrupted you.
Oh well, no. They're checking like what's called Babinski reflex. So.
Oh, with the thing.
Yeah.
Up the foot.
Looking for like, is there evidence of like brainstem function? But this guy has what presumably is DKA, diabetic ketoacidosis, which is a very common complication of diabetes, particularly in type 1 diabetics. We don't usually see it as often in type 2 diabetics. Type 2 diabetics tend to develop more of what's called like hyperosmolar, non-ketotic. Both can be very dangerous, very deadly. But again, we'll talk a little bit more about that at the end. But that's another really like bread and butter medicine topic.
This guy needs an insulin drip, right? 0.1 units per kilo?
No. Not without knowing his potassium.
Amen.
Insulin causes an intracellular shift, and if the potassium is under 3.5, the drip would kill him.
That is very true.
Also, she just one-upped him.
Insulin.
Well, more frequently, a precipitating event can be identified, such as pneumonia, urinary tract infection, stroke, myocardial infarction, pancreatitis.
Yeah, we always check for those. They're part of a standard order set, right?
Right.
Right? He's not going to say anything.
This is Mr. Randall. He's been erect for the last 8 hours.
Should have gone down by now, right?
It happens. It's a good thing you came in, Mr.
He's a nurse practitioner. I was wondering. That's what I like these badges.
Yeah.
An ED injection, 2 actually. I gave myself a second shot, 1 on each side.
An ED injection? Erectile dysfunction.
Yeah.
Okay.
Well, they said he's been erect for 8 hours.
Yeah.
Glucose 521, sodium 129, potassium's 3.7, chloride's 97, bicarb's 8.
So now you calculate an anion gap.
Big anion gap of 24. It should be under 10.
Yep.
Follow it to assess progress.
Actually, the 2024 and the national guidelines state that anion gap should not be used as they can be misleading in the presence of hyperchloremic anabolic acidosis. I recently had a case in the ICU. Which can cause cardiac arrest.
But the hyperglycemia causes the body to excrete more water and electrolytes, leading to severe dehydration, cardiac, and renal dysfunction.
He's enjoying this.
I know.
Low capillary glucose every hour, Chem 7 every 4 hours.
I see he's going to want a double lumen midline too.
I can do it.
7.5 club.
Can we just reevaluate our students not only on their fund of knowledge and on their procedural mastery, but also maybe more importantly on their skills as team players?
Yeah.
Yeah, she can do it.
Oh my gosh. Okay. Shows you the benefit of practical knowledge, like learning by doing. I don't know what I'm trying to say. Yeah. Because you learn that from a
Experience.
case. Yes. There you go.
And about ketamine only.
No, we need full paralysis for a successful first pass intubation.
Ketamine only, 80 milligrams.
In that case, I'll leave this in your capable hands.
There you go.
30 minutes ago, I told you I'd never been sued. I'd like to keep it that way.
Oh, that was completely inappropriate.
Yeah.
Said it in front of a patient too. Like,
Well, it is a medical emergency. If left untreated, priapism can cause permanent damage to the penis and erectile dysfunction forever.
Sterile bolus saline. You might need to refill since they'll be flushing over and over again. Hold out the empty basin to catch whatever they pull out.
This poor girl.
I know.
He's out from Versed. Did a lidocaine block to the dorsal penile nerves for 10 and 2.
Yeah, he's ready.
Excellent.
Is he asleep?
I assume.
How deep?
2 centimeters. Now aspirate.
Will you guys do this like every day?
If we're lucky.
I'm not going to touch those questions.
For what it's worth, I've never seen that be done.
Good view of the epiglottis.
But, obviously I didn't work in the ER.
Mystery solved.
Oh, foreign body.
Is that broccoli?
Yeah.
I can see where the Heimlich didn't work.
What were they pulling that out of?
Looked like his, like just below his epiglottis.
Epiglottis?
Epiglottis.
I don't know what that is.
Structure in the back of the throat that's supposed to help keep food, particle, and drink and stuff from going into the airway.
Oh. Didn't know that existed.
Never met a Pete's nurse yet that wasn't a little wacky. You know what 12 hours of crying babies does to a person's psyche? Trust me, too long up there, you're cuckoo for Cocoa Puffs.
You are very punchy today.
Yes, he is.
Where is Dr. Allycia?
In Lord's 5 with the priapism?
Better her than me. I did not intend for that to come off as sexual in any way. How we doing in here?
Good. Almost 4 liters out.
I already feel like $1 million. I just needed an oil change.
Change.
Keep it up with it again.
My God.
Up to an hour, sometimes 2. Mal, any suggestions?
Oh.
You did these at the VA. How can we facilitate detumescence?
Oh, sometimes massaging the shafts can help.
That's what she said.
You said you hadn't been sued.
I haven't, but I know many colleagues who have. I also know your work, Dr. King. Your medical decision-making in the chart is always extremely thorough.
Yeah, we're getting somewhere. First signs of flaccidity.
That's horrible.
She insists I eat 5 servings of vegetables a day. A rabbit don't even eat that many vegetables. I ain't never choked on a sausage egg McMuffin.
Amen, brother.
I thought you might like to see your husband.
Is that a good idea? I guess. Maybe. I don't know.
We'll see how this plays out for Whitaker the Wise.
I know.
This has been such a long day. I'm so glad to see you resting. But
It's a way to say goodbye.
Yeah.
It's going to be tough.
Dr. Robbie, is this a good time?
That depends.
Does it look like a good time?
Our doctors spend 40% of their time charting, only 28% of their time at the bedside.
That doesn't sound accurate.
Get the fuck off me! 2901! 2901, motherfucker! Get off!
Tell me some more about your ideas.
What's 2901 mean? All right. Moments during this episode where it's almost like a camera lens, right? Like, so there are times where the medicine is the primary focus point, and then so all sort of the social, psychosocial, and drama and whatever it may be is sort of that background, and then they kind of very skillfully shift it back and forth. And clearly, this show is done under the direction or guidance of physicians and nurses and like real medical personnel. This is interesting because this, new Dr. Al, I think Dr. Allycia, I think her name is, obviously very sort of modern in terms of her approach. She's adopted AI tech, which, by the way, we have adopted AI tech in my health system. I have actually found it to be very useful. But if you recall from the trailer, so spoiler for anyone who didn't see the trailer, but if you recall in the trailer, it appears that they were hacked.
Oh,
right?
That's right. We haven't got to that yet.
Yeah, not yet, but the systems go down. Well, as you can imagine, AI is not very useful when the systems go down. So
and that's what she keeps pushing for this initiative.
So I think she's going to get a little bit of a wake-up call with that when it's like, okay, none of your strategies are going to work in this, in this setting. So the nun...
oh yeah, that's right.
Gonococcal conjunctivitis. To whoever said that in the comments, you nailed it. Well, so and obviously, like what they highlighted here was that so she did contract it by exposure to some contaminated undergarment or something, which I don't know the data on.
Yeah, and you were thinking something else.
I mean, I don't know the data on how often it's transmitted that fashion. I'm going to say it's probably pretty low, but apparently it's not zero. So anyway, are we sure? I mean, I don't know. The nun may. No, anyway. Okay. So they highlighted a couple things that I think medical people, like people work in hospital setting, at least will appreciate. They talked about like the insurance not covering the stay, or they would only cover it here, or this network, or all of this just absolute BS that happens behind the scenes because insurance dictates everything we do. And it's really unfair and it's unnecessary and it's inappropriate. Dr. McKay is clearly rightfully angry about that. But that's not uncommon to not so much like the required transfer, because I never really saw that from where I was in the inpatient side, but the like 3-day minimum stay from Medicare to go into like a long-term care facility, that is absolutely happens. And so then you end up getting patients who don't need to be in the hospital, but get admitted into the hospital and get exposed to all kinds of things that might lead to a problem that requires them to then stay in the hospital.
Yeah.
Like a nosocomial infection or hospital-acquired infection. And these are not, so obviously like all because of some requirement that insurance outlined that has absolutely zero benefit in the grand scheme of things. So those are always very, very frustrating. And then, so Robbie seems to have a love interest here. Noelle, I think her name was. If I read that right.
It was obvious, I think.
I mean, maybe, I don't know.
Maybe, yes.
But, so then this brings up yet another, because that's the thing. This show continues to challenge us with these really like shades of gray. And I think that's what's made it so enticing and really like captivating, because it does that. Because even like working in the industry, working in this field, you get faced with some of these dilemmas here that we don't necessarily get faced with every day, but do happen. And then you're trying to decide like, what would I do in this situation? Like, how would I handle that?
You're talking about falling in love with somebody in the workplace?
Because you were my patient or whatever. Remember that? Yeah. But, that's a different story, right? Because
yeah, we've told that story.
Well, yeah, but so some may not remember that story. Do we really want to go all the way into
You don't have to go all the way into it. You can just do like a little short clip. We were like 5 and 6 years old, right?
We were older. No, so we were role playing as Dr. Patient, and your insurance didn't cover it. Okay, like the really quick 20-second. When we were young, so we have known each other since we were 4 or 5 years old. We started dating essentially at 12 and 13 years old. She grew up 2 doors down from me. Her brother was my best friend when we were young. So we played as part of the neighborhood thing, and we would always play like hospital.
Yeah.
And so during that, my brother and her brother were paramedics. She was the youngest and smallest, so could be easily carried. So we would use like those little roll things that mechanics use because her father worked on cars. And they would transport her on that as if she was a patient on a like a gurney essentially. And I played the doctor. And so
that's what I said. Technically, I was his patient.
Yeah,
at some point.
And I billed her, and insurance covered like 10% of it. And I've never got the rest. So, but anyway, that was the story about that. It was completely harmless and innocent. I know it sounds weird to say we like played doctor, but that was before, we were innocent.
Okay.
Anyway, all right. So, but yeah, relationships in the workplace. This is, I mean, it doesn't matter where you work. I think this is always a little bit of a like interesting topic.
One of your good friends.
Yeah, hopefully
Found
you guys.
love
Hopefully
in the
you guys
workplace.
meet that really good friend.
That's your little Easter egg.
Yeah, that's my Easter egg here. I think there can be problems with this if it's like direct supervisory rules, for I think for obvious reasons. But like if you're in different departments or completely different roles, I personally see no problem with it. The system or the employer, whatever. But that's not for me to decide. So this is an interesting one. Tachycardia. This is a mouthful. It is essentially broken.
Tachycardiomyopathy.
Close. Tachycardiomyopathy. Essentially is broken heart syndrome. And it's a real thing. And the reason we can diagnose it is because there's a very kind of what we call pathognomonic. So that term pathognomonic means like that there's a very obvious feature on testing that like only happens with this.
Interesting.
And it has to do with like echo findings of like ballooning of the heart.
And it's legit from a broken heart.
From a broken heart. So like, when the Bengals lost the Super Bowl, I had a smidge of tacos. No, I'm just kidding. I shouldn't make fun of it because it's legitimate.
You just broke your phone.
That was not during the Super Bowl.
Oh, that was playoffs.
I was younger. So much younger. Basically what happens is there is a surge of catecholamines in the body, of essentially like adrenaline, epinephrine, and all of those catecholamines from the adrenal glands that gets released in significant stress and anguish, and it overwhelms the heart. So it kind of weakens the heart. Thankfully, most cases of Takotsubo are recoverable. And yes, broken heart syndrome starts with taco. Remember Phil said that? Yeah.
Oh, yeah. One of our podcasts.
Yeah. So that was I think that's a cool one. It's we see it, so it's not like incredibly rare. DKA. I wanted to touch on this again because similar to last episode with the liver issue, DKA is another bread and butter thing, and obviously this prompted the gunner off, I guess is what we'll call it.
Yeah, gunner off.
Yeah, with Dr. Javadi, who I'm pulling for her because I think, we just know her more.
Yeah, we like her more.
We like her. Where's Mateo at, by the way? Have we seen Mateo this season?
No. It's very upsetting.
Are we sure we didn't see him?
I don't know.
Okay.
I'm not.
He wasn't in this.
Sure
He
now.
wasn't in this episode.
We just got done watching the first season not that long ago, so it's hard. It's blending.
But he wasn't in this episode.
No.
But I hope Mateo's around. That's not fun. Maybe he had Takotsubo because Javadi
broke his heart.
Broke his heart.
Yeah.
The tables have turned. I really like her by the way, character arc so far. Like she is really becoming more and more confident in herself because she's clearly got the goods. It's just a matter of like showcasing that.
Mm-hmm. Oh, she's showcasing it this season.
She is, which is an interesting. This is something I kind of want to talk about more in depth on another platform. Is the difference between like confidence and competence, and because the two are not always the same, you can be obviously confident and competent, but you can also have varying degrees of where that, anyway. So I think that that's an interesting thing here. I kind of sidetracked the DKA. So DKA stands for diabetic ketoacidosis. I think we mentioned this in the show. It is a life-threatening complication of diabetes. Like I mentioned, it's typically with type 1 diabetics, but it can, in theory, happen to both. And it is a significant metabolic disturbance in the body that generally manifests with like either loss of consciousness or significantly impaired consciousness awareness. And those people do need to be on usually insulin drips, kind of like that one Gunnar said, but you have to make sure potassium levels are normal. I don't think it'd be worthwhile getting into the weeds of like.
They could check out the podcast episode.
Well, I didn't want to talk about DKA.
Oh,
on
you
that.
didn't. Interesting.
It's really dense.
Okay.
And there's a lot of things that outside of just recognizing that it's a thing, it's probably not, but it's why we don't want people to get, and so he was right. Usually when people go in DKA, it could be from maybe not taking their insulin, but also it can be incited by an infection or something.
Okay.
So we do see that.
All right.
So lastly, I think the thing I wanted to save, should I touch base on the parking spot?
You can, yeah, I think so. There's a lot of people concerned about the outcome of the parking spot.
So for those of you who stuck around and listened to the end of our outro for episode 1, I got on this tangent about the parking spot, but I don't know that it would ever had like true resolution. So I'm happy to say that I am now parking in my parking spot again. There's no issues.
All is right with the world.
All is right with the world. The individual who was very sweet. She's no longer working at our office. Hold on. I had nothing to do with it. I didn't. I really didn't. I think
she probably was traumatized.
I don't even think she ever knew that. Like I was.
We're gonna have to find this.
Bothered
person.
by
I'm gonna have to see if she knew.
I don't think she never knew. At least as far as I know, she never knew.
How would you know? Did you talk to her about it?
No, I never talked to her about it. But no, and I found out. The
story continues.
The saga continues. No, I think she's moved to like a different office.
But why?
I can be persuasive. So no, actually, it's funny. Okay, let me backtrack here.
Oh my gosh.
This is getting off track here. So I had conceded. Like I had said, all right, like it's a parking spot. I'm not gonna I'm not legitimate outside of being like, why all of a sudden after 7 years, I started parking 2 spots down. It hurt for a little bit, but I kind of got used to it. And then one day it was just like my spot was open, so I took it. And then one day turned into weeks, and then it was like, hey, so then I end up going to our office manager, and I was like, where's this person at? Like I haven't seen them. They're like, oh, they're moved to a different location or something like that. So either that or Carrie took care of business. By the way, Carrie's my nurse. I got her permission to use her name. So she is the rock of my practice.
Yeah.
Anyway, so that's that story. All right, so that kind of wraps up everything I wanted to talk about there. One other thing I wanted to kind of tease, and I don't know if anybody would have any interest in this, but again, because of so many of the great comments we've had, and some of it is really insightful comments and questions. And please keep it coming because I love it. Like there's somebody had asked for kind of my opinion on the way the show has portrayed addiction, or the way that's portraying mental health issues. And I really want to answer those, but admittedly, it's hard to condense that into like a readable text. And so I got the idea of bringing my friend, who's a doctor I work with, different specialty, infectious disease doc, and bringing him involved in doing a little bit of like a more in-depth Pitt rundown and review. It wouldn't be like a pure reaction video. We would showcase clips, but we would really dive deeper into the concepts of the show, like addiction or like relationships and all the things that we see by sharing stories from our own experiences and practice.
Yeah. You got a name for it, right?
I mean, it's a working name. It's called the Pitt Stop. Um, anyway,
very creative.
Yeah, I just thought of it. So I don't know if, I know that that's a little vague also in its own right, but if anybody's interested in that, I think it could be something we have a lot of fun with, and then dive a whole lot deeper into some of these concepts that we're trying to kind of barely brush the surface of.
Yeah.
So I think that's all I got for tonight. Can't wait to get into episode 3 next week. Thanks for checking this out. I don't think I asked people to subscribe, so please subscribe, comment, like.
Are you
all the
like
above.
doing a little cutesy? No.
And please tag Dr. Mike. I would love to talk to him someday. Help me get an audience. All right, guys, this has been fun. We're gonna try to go to bed now. It's getting late.
Yeah.
Have a good night. We'll
See ya.
See you next week.
Bye.
I am Dr. Todd.